Okay, well, let's go ahead and get started. Do we have somebody to read the land acknowledgement? Who would like to do that?
I can do that.
Ira? Okay.
Go ahead. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Gracias, Mayra. Real briefly, our meeting practices, we often have that put up on the screen, but essentially we want these meetings to be, we do our best to make these meetings welcoming and comfortable for everybody. And some of the ways we do that are asking everybody to contribute, to speak up anytime you'd like to. Obviously, we don't want the meeting to flow and not be disruptive, but at the same time, you need to speak up. You can either use the reactions little icon button down at the bottom of your screen to raise your hand, or you can physically let us know like this on the camera, or you can speak up and we'll try to incorporate you at that time. We also do our best to not use acronyms so that everybody understands what the heck we're talking about. Use simple language, avoid using acronyms. And then we all ask all of us to do our best to check in with folks if we're not hearing from people, to check in with them directly. And with that, any questions around that or comments? And do let us know if there's anything about the way we're conducting the meeting that isn't comfortable for you. Let us know at some point. Introductions. So with introductions, we have an agreement to only introduce our Community Advisory Council members and any guests. And the other folks who are on the call, you can introduce yourself in the chat. And I'll ask Kelly if you want to help us kind of make the rounds for our CAC members.
Nope, I can do that. We'll go Brad, you first, and then Elizabeth.
Brad Porterfield, the chair of the Community Advisory Council, consumer representative, and also director at the Latino Community Association.
Elizabeth Schmidt, I'm the vice chair of the CAC and retired folk rehab counselor.
Stacy, and then Linda.
I am Stacy Shaw. I am a regional overdose prevention and response coordinator for Deschutes, Jefferson, and Crook counties, housed in Crook County Public Health.
I'm Linda Johnson. I'm the COHC, one of two COHC representatives to the CAC, and I'm a community representative on the council.
Tom, and then Mandy.
Hi, I'm Tom Kuhn. I work for Deschutes County Public Health. I'm a CAC member and am the public health representative for Deschutes.
Hey everyone, I'm cutting in and out, but I think you said Mandy.
Yeah.
Seeley, I use she, they pronouns. I am in Sisters and I am a CAC consumer rep.
Maida, and then Connor.
My name is Maida Beites. I am a CAC member and program coordinator for Family Resource Center.
Hey everyone, Connor Carlson. I am a consumer rep and I also work at Family Resource Center.
Okay, I believe that is all of our CAC members today. And we have a guest, Anna.
Hi, yeah, I'm Anna. I'm with Volunteers in Medicine. I'm a licensed professional counselor.
Great, welcome. Did I miss anyone?
Me,
Everybody-
good afternoon, Miranda. I'm a CAC member. I represent, Miranda Health, pronouns she, her, and I represent North County, and I'm with Klamath County Public Health.
Thanks, Miranda. Okay.
All right.
that should be everybody.
So fantastic. All right. So this is now time for public comment or a patient story. Anybody have anything you want to contribute as far as an experience you've had with a patient, or without naming names, or just public comment about Oregon Health Plan, Medicaid, health services?
Stacy won an award, so congratulations on your scholarship. I was reading the business and your picture was in there with the kids. So.
You want to say? you have something?
2000, then who was it from?
Just put something in your mouth.
Sorry, I was munching. It was from the Seroptimist International Group.
Oh, that's.
Yeah.
Mhm.
Seroptimus. Okay.
Yeah, really cool group of folks. Or ladies, is a group of women. Wow, I can't talk.
Yeah, congratulations, Stacy. Mandy, it looks like you go for it. It's okay if we praise Kristen every month. That's all right.
Well, like I said, I feel like I have praise for Kristen every month because I'm always asking her questions, always helping me. My husband had an emergency this week and ended up in the emergency room, and whether we could get crutches and all these different medical equipment. So she helped tell OHP covered what they didn't and the process to go through, and some other resources were able to get some stuff. So thank you, Kristen.
Nice.
Welcome.
I have something to share about Kristen whenever whoever's done.
I think you're up, Stacy.
So my kids' dad got like 6-7 different papers in the mail that were really confusing about whether or not he needed to renew. It said like, oh, you were denied, and then it seemed like he was denied, then he was renewed because he was just diagnosed with a chronic illness, and it's caused a lot of issues for him. And so he was like, I have no idea what's going on, and I have 7 of the same letters. So we sent a picture to Kristen, and I was like, I don't know. I have no idea how to interpret this paper. So
Just out of curiosity,
Thanks, Stacy.
Kristen, did you agree that it was confusing, or?
Yes, I actually went and looked at the OHA has created like guides on how to actually read and interpret the letters, and I actually used that to help figure out what the letter was saying. So I did find the letter to be not super straightforward, which was, I don't know. We're here to help though. We are here to help. So please reach out to customer service or anything like that. If you're confused, if you receive a letter, we actually reported this morning that will be provided, sort of feedback provided to OHA that people are receiving 4 or more of the exact same letters, sometimes in like a week time. And it's just really confusing. And so Erin Fair Taylor, the VP of Medicaid for Pacific Source, was going to take that feedback to the OHA and ask some more questions. We're not sure if the letters are being sent out based on case number. Sometimes families are assigned different case numbers. And so I think she was also hoping to just gain clarification why so many letters are being mailed out. And so hopefully we'll have a solution or some kind of information to provide on that soon.
Thanks, Kristen. And I assume Dustin would be the other channel for getting that feedback to OHA.
Yes, that's correct. and I don't have an answer yet, so.
Okay, well, you're looped in. All right. Okay, any other public comment or patient stories? All righty, well, we will move on then to approving our notes from the April meeting. Everybody get a chance to look those over and do you have any comments or anything you'd like to see changed that doesn't accurately reflect what we talked about?
I'm
I
happy
wrote,
with the motion, even though I wasn't at the meeting. So I move adoption of the minutes.
Okay,
I know I had a quick update to provide and I did not get that out through email. I apologize. But I have the number of unique writers, which I can also provide to Gwen. So when the emerging issues is back on the agenda, we have all that information updated. So the average number of writers for non-emergency medical transportation in 2022 for Central Oregon was 1,089. And the base number, so the total number of members is about 73,000. But what I found really interesting was across all of Pacific Source CCOs, we have about 225,000 members. And the number of unique writers was 3,610. So in Central Oregon, even though out of all of the CCOs, we're the third largest, we almost have a third of the writers. So I am going to take that back to an internal work group and sort of see what other people think about that. But it sounds like we could do a better job letting members know that that is a benefit. And then the other piece I had was the reimbursement. If you ask for miles to be reimbursed or hotel or food is 30 to 45 days. It can take them to reimburse.
Go for it, Stacy. Feedback on reimbursement.
So I asked our WIC person here at, I can't remember her title. She works with the WIC folks. She said that in their meetings that they have voiced and tried to work with whoever they have in their meeting on the reimbursement because the forms are really difficult for a lot of their clients to do, or they just feel like they can't fill them out. And then she also said that one of the biggest hurdles for her folks are car seats and having multiple children and things like that. She's received a lot of feedback that some of the families have not had drivers that were very polite because of the children and were very frustrated with the fact that they would have to get car seats or booster seats and those sorts of things. So it sounds like their monthly WIC group would probably have a lot of feedback on that program and has tried to voice it.
I would love to join that or be connected with them. And yeah, if you wouldn't mind connecting me, I would really appreciate that opportunity to hear what they have to say.
Yeah, and when I asked her about it, she was kind of frustrated. She was like, "Oh, we've been saying this, we've been telling them, and nobody like seems to care." And I was like, "Well, I'll see." But yeah, I'll CC you in an email with wow, her name blinked to me. I'll CC you in an email though.
Excellent. Fantastic. Let's see. So Linda, just heads up, we're not doing the formal motions on our notes anymore. But I appreciate you saying, letting us know that you feel like well, I guess you weren't there, but there's no problem with them.
I would love to follow up on Kristen's comment about the number of that a third of the demand for writers comes out of Central Oregon. I'd love to see the results from other CCOs and have that sort of overlaid with what's the transportation infrastructure, or what is it that we think may be leading to us having a third of the calls. Is maybe something that another area for us to partner with on social determinants of health on transportation linkages.
I can do that, well, for the Pacific Source regions.
Yeah, good question, Linda. Okay, so back to our April notes. This is your chance to express if you have any problem with the notes, if you don't think they accurately reflect what we talked about, speak up. And if no one speaks up, we'll approve them. But you're welcome to speak up. All right. April notes are approved as accurate. So this, today we are not going to have breakout sessions. Some of our members expressed that they're not crazy about the breakout sessions, at least not all the time. So we're gonna skip this time and we'll bring them back in the future. And for those of you who don't know, aren't aware, we usually do a 10-minute breakout with our Community Advisory Council members to kind of put us together in smaller 2 or 3 people groups to connect with each other on different questions. A little bit more on a personal level, sometimes professional too. And we're gonna skip it this time to give Miguel and Michaela their full time needed to discuss the next 2 items on our agenda. And with that, Miguel, we'll pass it on to you to talk about community engagement plan for the Health Council.
Thank you so much. Thank you so much, everybody, for having us. We have the opportunity to bring this in front of you because the board is going to have their retreat next month, and they explicitly ask for the CAC advice to ideas and feedback and advice about how to better engage the community into the work of the Central Oregon Health Council. So the opinions, the feedback that we are going to collect today is going to be shared at the board retreat, and possibly that will be used to refine and inform the 2020 strategic plan of the Health Council. So thank you so much for being with us. Next slide, please. So that's the purpose of the activity, but what are we going to talk about in slide 2? Yes.
Sorry, one sec.
It's okay. It's okay, Michaela.
Yeah, what I just did.
Yeah. So what aspect of the strategic plan we want to touch with you is about the direction number 5, which is about identifying and addressing inequities. And there is one part of that. There are several parts in that strategy, but there is one that is very interesting and the one that we're going to discuss. Bolster community engagement to ensure diversity of voices during decision-making process. And this is super important because it's really trying to bring the communities, the users of the services, and participate in the decision-making process. That already is super exciting. So before jumping into your ideas, let's reflect a little more about what is this about. So next slide, please. So just share with us ideas. When you hear community, what does it comes to your mind? And thank you, Gwen, because she's going to be taking notes. Doesn't need to be any definition, just what it comes to your mind. If you want to share popcorn ideas. Family, said Stacy, thank you.
People coming together.
People coming together, thank you. Events, yes. Common interest, yes. Food, okay. Where we can grow and learn. Thank you, Miranda. Location also, yes, like the community, the Bend community, right? City, county, or region, yes. So as you see, community can be defined in so many different ways, right? Next slide, please. People working together. Thank you, Tom. So in the next slide is about, from your knowledge, what cultural specific communities are already represented at the work groups or at the committees or at the board? I can tell you that Brad represents the Latino Community Association. That's the one I can remember, but I wonder what other culturally specific communities are there. Thank you, Ben. Rural providers. Well, it's true, providers have their own culture, yes. Tribal communities, yes, there is people from the tribal communities at the CODI and in other work groups. Thank you. So next slide is about, with these two ideas, what do you understand for community engagement? Because that's the purpose of that strategy, to bolster community engagement. So we are already seeing that community could be many different things. So community engagement, what will be that? Listening sessions, thank you. Convening conversations about topics. There's a lot of ideas in the chat. Thank you for using the chat. That's great. Showing up where our communities are. Welcoming space. Yes, there are a lot. Focus groups, building trust, inclusivity. Okay, so thank you for all, and continue putting ideas on the chat. This is so rich. So what is the Health Council already doing around community engagement? So we prepare a list just of general ideas that it's already happening. How is this happening? So next slide, please. Because yes, it is true. For example, if we define community as providers, we have more than 200 volunteers. Most of them are health partners, so doctors, dentists, managers of hospitals. But not only that, we have representation from school districts, transportation, housings, etc. That's just around the health area. Next slide, please. So another way to do that are the work groups that are driven by the Health Council staff, like the committees, the information that we provide, the work groups, the grants, the investments, the events, etc. I'm not going to get into detail because we just want to share with you a panoramic of what is happening already in this definition of community engagement. Next slide, please. We provide information, we provide trainings, we do presentations, we participate in classes, on tabling events, etc. Next slide. We share resources for events, like we provide sponsorship, but also attend or provide dinner event invitations, and we partner on fundraising events. Number 10. Next slide. In the media area, we do a lot of things. We are present in social media. We are collecting information through surveys or listening sessions, particularly right now with this the regional health assessment. Next slide. We attend community events, all type of community events, from open houses to parties. Like just last Saturday, we were in Prineville with Stacy there. Thank you. Next slide. And also we provide expertise to other groups, either participating in external committees or supporting the work, right? So as you can see, the Health Council, next slide, please. This is just an overview of everything that is happening to give you an idea that, yes, community engagement, it's fantastic. It's something that we are already doing. We have a lot to celebrate, a lot to be proud. And this is great for everybody. However, next slide. Can we do even better? Yes, we can. If you when you were talking about what communities are represented, who is working, participating at the Health Council, we think that we can do even better if we reorient the community engagement that we are doing with an emphasis on diversity, equity, inclusion, and justice. And the reason for that is that most of the health partners that are participating with us, it's really, they come from health or their organizations, yes, many of them, but we still need the voices of the underrepresented communities. And so that is the effort that we want to launch now. So to do that, we have prepared, next slide, a mainframe to do this. The first one that we want to share with you is this temporary definition about what is community engagement with this reorientation. It's a process that requires tools and strategies, and it basically focuses on building trust, building collaborative work, share leadership, and also try to improve the power balance between the Health Council and the people who benefits on the work of the Health Council. That is the main definition. In order to do that, we are going to pursue 3 different strategies. Next slide, please. And they read very simple. The first one is build the idea. Everything is first an idea. We need really to, in order to embrace this orientation, it's not easy, but it needs to be shared, understood, acknowledged, and resourced by all the actors, all the partners in the Health Council. The second strategic direction will be build the capacity or develop the material conditions to really prepare the work, be ready to have collaborative work between the Health Council and the members of the community, really. And then the last part is empower the communities. And this is also an important part. Without that, it's going to be very difficult to share power, to share decision in a way that is useful for everybody. And so what it means, empower the communities. The last slide on green. Next one, please. It's really, it seems simple, but community members need to be informed. At this moment, it's very difficult to explain to our community members what is the Health Council doing, what is a work group, what do they can, where are the opportunities to participate and to benefit and to advocate for their community working with us. It's very difficult. The first task we need to do is to inform them. We need also to consult the communities. And we have an innovation now with the regional health assessment in which we are consulting, but it's really a new type of work. And hopefully get them involved and hopefully collaborating in the decisions that affect the health in their communities. This is the challenge that we have in front. The model, it's more complex, but as an introduction, I want to stop here just to begin to jump into collecting your feedback about what do you think is needed to move towards this reorientation of the work. So can I stop here before going into the next slide? And or rather go to the next slide and open a few minutes for questions or clarifications.
What was the question again, Miguel?
Oh, we are going to begin to work together. So there is no question. I'm opening the floor for questions or clarifications about what I presented. Thank you, Martha. It was just an introduction for you to give us a context of what we are trying to do, what is needed, where your feedback is needed. Okay, Michaela, let's please give me the, okay, let's go to that. So the exercise that we invite you to do with us has two parts. In the first part, because the CAC really plays a very special role. In one side, you are already part of the organization. You are, as a committee, you are already there, but in another way, you are representing the community. So we are gonna have 3 different slides for your 2 hats. The first one, I'm gonna ask you to wear your committee hat or work group or board, right? And for the second part of the exercise, I'm going to ask you to wear your community hat in the way that you are advocating or representing different communities. So for the first part, wearing your institutional hat and thinking that what we are looking to do is partnering with the communities. We want to know what needs to happen to show and confirm that DIG is a strategic priority for the Health Council. So how should the board, this is the question, how should the board, work groups and committees express their intention of working to advance DIG as a priority? How do you think this work needs to be expressed? What needs to happen?
Hey, Miguel, it's Connor. Can I ask you a question?
Sure.
How do you partner with St. Charles and these other health groups to make sure that they have a DEIJ priority as well? Because if Central Oregon Health Council has one, but no one else has one, does that defeat the purpose? Do we need to partner together and have a collaborative CCO DEIJ that the whole community understands and everyone can simply state and understand?
So thank you, Connor, for the question. I think that collaboration, that coordination, that working together is absolutely part of what needs to happen, because maybe St. Charles have it, right? Pacific Source, they have that. But there are many others that they are not there already recognizing that resources need to be invested for this to happen. Yes. And we can make it better always. Thank you.
Miguel, this is Linda. I'm a little confused about the 2 questions. The first question is what needs to happen to show and confirm that DEIJ is a strategic priority for the council. I guess I was assuming that because it's one of the 5 platforms in the strategic plan that the council has stated that it is an intention. And why do we need the community to confirm that for us? Are you asking, what does the community need to show that there's continuing need for that? Or just the way the question is phrased, I'm not quite clear what it is we're trying to get to.
Thank you, Linda. So the idea here is that we hope to go deeper than at the operational level, in the sense that expressing the intention, it's important. In this case, you said if it is already in the strategic plan. So the idea is that how do we get further to that? So,
okay. So it's what does partnering with the community mean, and what are some specific ideas that we have about how to deepen
yes,
our performance around DEIJ? Is that sort of the question you're asking?
yes, yes.
Okay, thank you.
Another way to ask it that comes to mind is somebody who's been doing this with the council for a while too, is yes, there's a statement. What else? Is a statement enough, or are there other things that the board, the work groups and committees need to do and take action on to express their intention around DEIJ?
Thank you, Brad. Do you want to share something vocally?
I mean, I guess we can repeat what I wrote, basically, and this comes up again and again, and but basically, for consumers, and I'm just focused on consumers because that's the only way that I can function at the moment. Because if we look at the whole health council, board, work groups, everybody, it's just too big. So since we are the voice of OHP consumers, and I don't see consumer participation in hardly other than the CAC, and I still keep repeating that we're a small number of consumers, so we're hardly representative. We do our best, but on the work groups, I don't think there's very many consumers. Correct me if I'm wrong, but I don't think consumers are well represented on work groups other than the CAC. And just in general, I think we need to make our existence known. Like, what is the Health Council doing? What are, that there are these work groups, and yeah, just better marketing, better communications.
Thank you, Brad. The exercise that you request, I found some data from past years, and we found that 87% of partners are organizations, and 70% are medical or healthcare partners. And at that time, the LCA was the only culturally specific community-based organizations. Now, I think we have a little more, but not much.
So Miguel, can I ask just to clarify? So did you just say that 70%?
87% of partners were organizations. So that means that only there was less individuals or community users.
Okay.
70% of those organizations were medical or healthcare related.
Gotcha. Okay, thanks.
And I know that in one of the work groups that I sit on at one point, 2 or 3 years ago, we did an analysis of who are we working with. And there was the faith community that was an outlier. And yet a lot of churches and religious organizations really care about the community and put concerted effort, whether it's improving reading skills or food insecurity or whatever. And if we're not engaging them in the conversation, I think it's helpful to identify what cultures or groups that are not healthcare are not at the table for us to talk about coordination, education, all of the rest of it.
Yeah. Thank you, Linda. Okay, let's jump to the next question. Oh, sorry, Stacy, you have a question.
So I was just going to add to that, being someone who has an issue joining work groups, I'm a part of the housing work group, the substance misuse, and the behavioral health one. And I have to say that each work group is very siloed, and everybody, essentially, if you were to, like turn off the camera, their titles are the same. So there's not a lot of diversity in that realm. I understand that, behavioral health, you need behavioral health folks at the table, but I also think it would be helpful to have some of the other people who are dealing with behavioral health, like the peer support folks, at the table as well. And then in the housing group, I joined that one because I know that there's a lot of stigma behind substance misuse in housing. And that was a really interesting meeting, my first meeting, because that came up right away. And so just kind of seeing all of the overlap and all of the things that are happening, but there's just everybody is pretty similar in their role. It's really hard to represent certain communities or aspects of the community if everybody's kind of the same. I just want to put that out there.
That's a great comment, Stacy, and it's a great segue to the next question in slide 20, which is about how do we become more inclusive and welcoming? How do we make the board more inclusive, the board groups, the committees more inclusive and welcoming, to precisely attract that representation, that different views, the richness of the experiences.
I think one of the things that is occurring to me is that I'm not clear what the outcome of the efforts we're talking about at the bottom. What is the outcome that we hope for, and do we have a way to measure that? I mean, it's one thing to say we want a world and a community where DEI and justice is active and robust throughout the community. And maybe that isn't the goal. I'm not sure. I think it is, but how, it's that piece is just missing for me. What's our goal for this?
Yeah, I think the first goal, Linda, I'm going to try to answer from a musical perspective, if you want. If I just meet with the people that plays guitar, for instance, and one specific type of music, it's very normal that the music I produce, it comes to my creation, to my mind, the solutions that I get for my music is going to be influenced just for guitars and just for the style of music that I play. Instead, if I can sit and play with different musicians from different genres and getting more instruments, in a understanding, making larger my context, it's very possible that the possibilities of my music will be enlarged. So in the analysis, in the first part, we see that the number of providers that it's overwhelming in correspondence to the people that receive the services. So the intentions of bring diverse voices and to include them not only into the work groups, but in the entire process of making decisions about what they are going to receive as final services, it's per se enriching, at the condition that we do it in the right way. So it is not just about, it is about very tangible aspects. If we can bring these voices into the tables that are making decisions, and they can advocate for their own communities and their needs, our experience servicing everybody will be richer. That's that. Did I answer your question, Linda? I hope I didn't miss it.
I'm not sure. Using your musical analogy, if I know that I want to create a piece of music in a certain genre of music, and I invite lots of people in and I say, how can we create a composition that is in this musical genre? That's focused and clear. If I invite people into the room and say, I want to create a musical piece, and I don't specify the genre or whether it's for a whole orchestra or what's the purpose of it, then it becomes, if I invite a lot of people without that clarity, I get a lot of input and actually can create some discord. Does that make sense?
Yes, totally. And that's the reason why we have focus areas like communities. So the people that it's around the behavioral health or substance abuse. So we know that there are communities that they are suffering specifically more about that, but they don't have the opportunity right now to bring their voices into those groups. So yes, I agree with you. Some structure is needed, and you are getting faster than me, because the green slides is about what do the community needs to precisely understand that work, that type of work that is needed to work together and collaborate. So give me just a few seconds, Linda.
Okay.
I hope we will get there.
Thank you.
Stacy?
So to address the question that you're asking, become more inclusive and welcoming. So what can we do as a CAC and to spread the word? Because when I talk with people, you know, my neighbor, my friend who's having issues, the way I go about it is, you know, wow, you're really passionate about this, or wow, you seem to have a lot of great ideas. Where are you putting those ideas? What are you doing with those ideas? And they're like, I just, you know, it's always kind of the same thing. I keep it to myself. And so I always go and I say, well, you know, there's a health council and there's a lot of work groups, and it's the same, well, I work during that time, or I can't during that time. But I mean, I had 3 conversations just this week with people about the health council and things that they were talking about that would be amazing in all these groups, but they just can't meet that 9 to 5 Monday through Friday kind of structure.
So we're talking about, we need to enlarge our vision of regular 9 to 5 structure, for example, as another part. Yeah.
Yeah, it's not inclusive.
Thank you, Stacy. What else, guys? There is many people that hasn't shared yet their ideas, and I'm sure there are great ideas there. I don't want to call anybody, but please jump. Okay, let's move because my time is finishing. Let's go to the next slide. And this is a question about how to improve power balance between the health councils and the communities at the moment of taking decisions. Oh, we have another comment. Thank you, Mandy. Include interpretation for every meeting, subtitles and Spanish. We are gonna collect all the things that are in the chat, so thank you. Speaking or writing. So slide 21, what do you think that can be made to improve the power balance between the health council structures and the communities that at the moment of taking decisions? Thank you, Stacy. All communities are represented.
To my knowledge, it sounds like from Crook County, I can't remember his name right now. He has red hair. He hasn't come to a board meeting in like 2 years. I'm just saying, is there a way, if we have Crook County folks who are going to the board meetings, that they can sit at the table instead of just having that seat empty?
Represented and active. Yes, thank you, Stacy.
Stacy, are you referring to the elected representative in Crook County?
Yeah, Seth. Thanks, Kristen.
Yeah, that's something that's come up before in my conversations with like Michael at the Jefferson County Health. The fact that public health, like leaders, I mean, Tom's here on the CAC, but on the Health Council itself, board, they're not at the table.
And that's I agree with Brad. That's been a cause of concern with the council itself. And we are legislatively mandated to use, those seats are designated by the enacting legislation. So we have to have a county commissioner from each of the counties. So, and the commissioners themselves decide which one comes to the meetings. There's really no enforcement mechanism that we have that the council has to get an improved attendance. So it would have to be, I think, from the community perspective. But it is a challenge.
Do they get sent anything like, hey, you've been gone for 25 meetings out of 24?
Yes, there've been conversations, multiple conversations between the executive director and the councils, not just in your council.
Yeah.
And our bylaws that we just have in our policy manual that we just spent 2 years overhauling has a mechanism for, because it's a board performance measure. Are you attending meetings? And there's a mechanism for people, for the positions on the council that are not required by law. And there are different ones for ones that they're legislatively appointed. So it's a challenge. I don't want to distract from the conversation. I'm sorry.
And just to very briefly follow up though, is I had asked this question at some point in the past and I was informed, I don't remember by who, but I think somebody on staff, or maybe might have been Donna way back when, I don't remember. But they can delegate. The elected representatives can delegate somebody else to represent the county if they can't make it. That's my understanding. So that option does exist. They just apparently either don't do it or I don't really know. But to move us along, I want to just reiterate what I think I saw in the chat, and that's the only way to balance power really is to have more participation by those who are not at the table. So more consumer representatives is what I'm going to continue to harp on. And I think that's what was said in the chat. So.
Thank you, Brad. So
Miguel, when you talk about power balance, can you speak a little bit more to what that means? Because when I think about it, I think about the question in the context of what can the board work groups and committees do to make sure that the council is best informed in the decisions they need to make. And so I'm not, that's a little different from a power imbalance. What power balance do you see and are you referring to?
Linda, it's exactly the same, except that it's phrased in a different way. So power imbalance is a reality. What we want to create is more power balance. So power imbalance is like that. And that's stated in a negative, in a difference. So I stated only in the idea that we need to uplift the power of those who doesn't have the voice represented or are not present at the moment of take decisions.
So making sure that their voices are heard so that the council is better informed for the decision it makes.
So that's a nice way to say it, but that's not what I'm talking exactly.
Okay.
The fact that the voices are heard, it's important to inform decisions. The fact that the voices are part of the decision, it's qualitative different. And I think it's like when you go to the doctor and you don't have any opinion about what procedure you are gonna suffer, that's a clear power imbalance. So you need to have the opportunity to listen to the reasons and participate in that final decision. And that's just a human right.
Okay.
So listening to communities is not enough. They need to be involved in the decision process.
Thank you.
So guys, respecting the time that it was allowed to me, I need to stop here. We are gonna send you the 3 green slides that with 3 questions to see if you have time and if you want to share with us your ideas, that would be great, and that will be incorporated to the feedback to the board. So that's about how do we support the leadership of the community, how do we support their level of to development of advocacy and the ability to work with the Health Council, and how do we gain trust or we build trusted relationships with them. So we are going to send those by email, and hopefully you will share your ideas with us, but I will stop here because of the time it was allowed to me. So thank you so much. If there are any last questions, I take it. Abolish the peanut gallery. Okay. That could you tell us more about that? That's a new term for me, Stacy.
So at the board meeting, there's a circle and everybody gets, a table and a nice little placard thing with their names. And then everybody else in the peanut gallery sits behind them. So right there, as soon as you're walking into that room, it's like, yes, come speak and you're welcome, but sit back there. You can't come to the circle. You're in the peanut gallery. So to me, my first thought was, wow, I feel so welcomed in this closed off circle where everybody's back is to me. So I think even just making that space more inviting, like still have your placard and everything like that, but if you want community feedback, you want community engagement, then make it a space where you can actually engage and not just be shoved to the peanut gallery.
Thank you, Stacey. That's a very good example about the little changes that are real life changes that create more inclusive environments for everybody. Thank you. Well, thank you so much for the time. Thank you, Brad. Thank you, Council.
Gracias, Miguel. And thanks everybody for participating. Well, we'll go ahead and move on to Michaela and our community health projects discussion.
All right, so we are going to shift gears and I'm going to share my screen. All right, 1 second. There we go. Can everyone see that all right? Okay. Okay, so what today we have for you is the 2023 process for the community health projects. A small group met a couple times last couple months to develop this process that we'll share with you all. So folks that were in that small group, feel free to contribute as well. But just as a reminder, the community health projects, they are meant to be community level projects that address social determinants of health and equity. This year you have around 2.3 million. So that's a little bit more than the last time we shared this number with you. And that's a conservative estimate. And funding decisions have to be made by the end of the year each year. And so that's November of 2023. Yep, and so we had a small group that met a couple times last few months to address the feedback that we had in February of, last year you had about 72 applications to review. And, with that, it was difficult to compare all 72 applications to make an informed funding decision. It was incredibly time intensive to review. And it also took away from some of the other major priorities that the CAC has. And then within the small group landed on some themes. So one is to identify 1 to 2 priority issues to fund fewer but larger grants, and then emphasize or prioritize funding organizations that haven't been previously funded with the community health project funds. So given that information or that feedback from the small group, this was the proposed process that the group agreed upon. So it would be, we would fund a couple large projects per county, and the 2.3 million would be equitably distributed or divided up among those, and it's the counties and the tribes based on health disparities and needs among the counties and the tribes. And then each county would have a dedicated RFP so the applications wouldn't get mixed up or confusing. And then for the tribal funds, those would go to the tribal liaison to work with the tribes separately, and it'd be a separate process. So the CAC wouldn't review those applications, but it'd be a conversation with the tribes and their community needs that would also align with all the requirements of the community health projects. And then further detail about the process. Like I said, each county would have their own separate RFP. In order to fund larger grants, we would have a grant floor or grant minimum of $100,000. So the grant request would have to be $100,000 or larger. And we wanted to emphasize within the request for proposal that grants can be up to 5 years. So this would help some of the smaller organizations that may be applying to build some sustainability over those 5 years, so they could spread those funds out. We're thinking of communities like Northern Klamath that, receiving a large chunk of funds might be a little difficult, but if the smaller organizations were able to spread those funds out, it'd be easier, and they'd have more sustainability. And we'd also encourage collaborations in order to support those grassroots efforts. One of the themes that was identified was giving preference to organizations that haven't been previously funded with these specific funds. And so when the applications come in, they'd be tiered. And so the first tier would be the organizations that haven't been previously funded. And then the second tier would be from organizations that have been funded in the past from these funds. And so the CAC would review the tier 1 and decide on funding first. If there was funds left over, then they would review and look at tier 2.
Michaela, can you talk about what's the concern underlying this piece of it?
It was to make this process more accessible to newer organizations or organizations that haven't accessed these funds yet for a number of reasons. And I'd also like to open it up to folks that were in the small group to share their reasonings as well.
I can say from my standpoint, some of the Central Oregon Health Council's money in I think even the CAC money, or it's all the same. Some organizations like to say they're serving a certain population. One of the things we've done here in Kirk County is to track down who is saying they are serving our population and if they are serving our population, which is the rural Kirk County residents. And so far we found 2 that aren't. They said, well, we put Kirk County because we're not excluding them. And some people do come from Kirk County, but they have not once stepped foot in our county. And so for me, it was really important to do something like this to make sure that some of these funds are actually going to these rural communities, because I have a feeling if we were to actually do an analysis of where did our money go last year, the majority of it probably stayed in Deschutes. And so, like, for me, that's kind of my feeling around it. And I know that Jefferson's probably similar. And then also in Deschutes, the smaller rural counties around them. Just put that out there too.
Thank you. This is really helpful because I asked the same question a couple of months ago, just to be able to track where since we've been funding these grants and the Health Council's got a lot of money on the street. Do we know which organizations have received those funds? And what I was told, I believe, is that we don't have the mechanism in place today to do that. My concern, it's a little different, which is as a part of the Health Council, if we were asked by the public, with all this money that's been put into the community, how do you know what have you received for that? How has the community been improved? How have we in social determinants of health, for example, have the funds been used in a way that decreases the problem or addresses the problem? And a part of that is how much goes to what organizations. So I think the outcomes and how we measure that and whether that money, that investment that the Health Council is making in the community is actually changing, moving the needle at all is a big question. I think that the council as a whole needs to be ready to answer. And so having said all that, I'm not sure that defunding any organization or not putting them in a second tier would be a more fair way to say it. To put an organization maybe that has received funds and is doing a great job, if we put them in the second tier, I'm just concerned about the impact of that.
I also think that this prioritizes more grassroots organizations and wanting to give, larger organizations that already know the process can access these, the applications with ease. It kind of gives the other organizations that, might be working within the community to kind of elevate those. I think that was some of the thinking within the group.
And I can support ways to make to reach out to bring people who haven't been previous grantees forward. I totally support that. I'm not sure that how I'm understanding this by saying that the people who have been doing a good job won't be in the first tier, that it feels like no good deed goes unpunished.
So I think part of the thinking of the small group is that historically, the CAC has prioritized the smaller organizations, rural organizations. It's also been reflected in the scoring that y'all have developed. This isn't just another process step or mechanism to in the review process to have them reviewed first. It doesn't mean tier 2 wouldn't be reviewed or funded. It's just a way of pacing out the review piece so that time and energy are initially on where y'all had said your priorities are, and then bringing in the others. So
well, it says here that if you are in tier 1 is funded first, and if funds remain, then the tier 2 might get a shot at it. To me, that doesn't feel equitable.
And I think the intention is, the knowledge is that the Health Council has funded a large portion of organizations, and there's probably few organizations that haven't received funding. So the folks, I think reality is that the organizations that haven't been funded, that have work that are applicable within the scope, are probably significantly fewer in number than organizations that have been funded as well. So, and obviously open to hearing other concerns around this and revamping it as well.
PAC members. Let's.
I was looking for Connor. I was like, where's Connor?
Do you have anything? Go for it.
Go, Brad.
I refuse. Go ahead.
Yeah, I think, Linda, you bring up a lot of good points. I think it's, any change is hard, and I think we're just trying to make it a little bit easier. I guess I don't have any good points right now, other than I think, as long as we continue to massage the process and learn from how each session goes and refine it moving forward, I think that's something that we, should do, and not just be stuck with a rigid process. If that helps alleviate any concerns initially.
I'm all about improving how we do things and not being fixed into anything rigid at all.
The other thing that I'd contribute is just because of a comment you made, Linda, and I'm interpreting it the way I'm interpreting it, not necessarily how you meant it, but sometimes a process, we get into the tension between equity and equality. This is not equal because we're saying, and none of our processes, because we're raising priorities up as more important to us than others. And in this case, we're saying we want to make sure that smaller, not even smaller, organizations that have not been previously funded, they don't have to be small in the ways as explained at the moment, get an opportunity to access these funds. So that's really more about equity than it is about equality. If that's helpful at all, but I think we should. I think we can move forward and incorporate your comments, because they are good ones, Linda. That we just need to be mindful of not excluding anybody because they've been funded before. If they're doing fantastic work, we want to take that into account.
And lift up those that haven't been participants in the past.
Yeah, exactly.
So what are we kind of landing on here?
I think it's interesting that we just got done with Miguel's presentation, and we come with a new thought of how do we be more equitable with money? How do we include parts of the community who maybe don't feel like they have a voice or a platform for that voice? And then I'm not hearing a lot of feedback besides, uh-oh, this may not be equal or fair. So I think it's important. I think this is a good opportunity to kind of pan those things out. Like, it's different, but it also could be more equitable and diverse for those communities and help us work into some of Miguel's presentation that he had for us.
I think of it in terms of, is this the best way to achieve what that goal is, which is to lift up the number of participants who have not been a part of the solutions in the past or recipients of funding? There are lots of ways, I suspect, to do that. This is one that's proposed.
It also raises the question of how are we going to identify, how are we going to get the word out differently that will increase the odds that we're going to get more organizations that haven't previously accessed these funds for whatever reasons. So we don't need to decide that now, but certainly raises that question for me.
I can't remember if we did this, but on our last session or two, did we do a post completion survey with organizations to ask them their thoughts about the process? Did we get any feedback from them, good or bad?
So that was an idea. We haven't done that.
Okay.
Is there a middle ground on this that we could all live with? Is there a softening of this? Is this, what can we live with here?
If I could pitch in something. So my understanding of what we're saying here is all we're doing is we're not excluding anybody, but we're saying we're going to first assess proposals from organizations who we've not funded before through our process, community health projects. So no one's excluded. However, I guess we are kind of saying here, the bottom part of that is if funds remain, and maybe that's where Linda, it doesn't feel good for you, perhaps, because that sort of does get into exclusion, perhaps. So if all we're saying is we're gonna first review unfunded organizations or organizations we never provided funds for before, and that's, I think what you said, Michaela, that's likely to be a pretty small number. I don't know if we have any sense at all of who's out there that hasn't accessed these funds that we think ought to. I certainly don't have any sense of that personally. Prioritize, yeah. So I don't know if Linda, you've voiced most strongly your concern. Do you feel comfortable if we carry your concern forward through into the process?
Yes, and I'm First, I want to apologize if I've offended anyone at all. It's not my intention, and I am totally aware that I have unconscious biases that I've not even confronted yet. And every time I open my mouth, I learn. So apologies for that. I'm committed to the work of CAC personally, and for lots of different reasons. And I sit on the board, and I have this ability and this situation where I'm sitting on both. And I'm trying to find a middle ground as well. So if I see something that's being presented that I know will go to the board, I want to speak up about that, so that if I were silent, then something could be presented that the board might have a very strong negative reaction to. And I just want to speak that. So if you can share my concerns, I don't have a need. I like the change that's, prioritize instead of if funding remains. I think those are triggering words if you happen to be a provider that has done a great job and produced outcomes. And I'm just trying to think in both worlds. What's the way we can bridge? And maybe some of this, it's not the place to brainstorm, but I'm thinking maybe there's a way in the application process that if it's a first-time funding partner, they get an extra point in the analysis, or, we've done that in lots of different ways to emphasize the priorities through the scoring process. As opposed to an absolute, you're tier 1, you're tier 2.
How about this? How about we go through the rest of the process, and then we can circle back on the pain points and flesh that out a little bit more. That work for folks?
Mm-hmm.
All right. So with the scorecard, it would have, the product description overview, same as last year, equity, same as last year. This group wanted to prioritize rural communities. So projects serving rural communities. And we look at the region, that would be basically projects that serve everywhere except for Bend and Redmond. And then community-based projects. So the intent behind this is that projects were created by and for the people within those specific communities, and the applicant was located from that county, that community. And then projects that provide basic needs like food, water, shelter, clothing, and hygiene products. Anything folks would like to add? That were part of the process?
What about like physically in the rural communities? Are you serving the rural communities because they can come to you, or are you going to them? I think that would be a really great clarification just on my part.
So for the rural piece, projects that serve rural communities within those communities.
Like, can Lapine just go to Bend, or do you go to Lapine?
And I think that if you look at the next one, it's community-based projects. I think that's where we're trying to get at that that messaging that we've heard from our smaller communities is that the project was created by and for the people in those specific communities. So to help promote in the rural regions, it's shared that there just aren't a lot of CBOs in those areas. They might have one or two to serve the broad needs, and that's not sufficient with just the way larger systems work. And so this helps promote that. And it still includes, you know, through the review process, our existing orgs that have spread and grown into those communities will still continue to be, you know, valued and supported through this process. So, I mean, I don't know if you all remember, like, I think in last year, I think most organizations got all or partial of their funding by the way it worked out. In the previous year, there was a lot of work done by you all to help ensure most organizations got all or most funding. So that's, you know, one of the gifts that you all bring to the wide region, and also the challenge in the process and the work of doing this as the group that you are, the need, and just the limitations of doing grants too. So
I do have one question about the project serves rural communities within the county. So I can't imagine a project. Well, first of all, what defines rural? I mean, I know when we're talking about smaller communities, that's pretty clear. Does that mean that any project that's within the city of Bend, for example, would not be eligible to apply?
They would score lower here. And the Health Council has a definition on rural, and I can send it to you.
That'd be great. So if they're, okay, I'll let it go there.
So it's not eligibility, it's, yeah, scored lower. And I think there's the recognition that even in Deschutes County, there are smaller communities that would be considered more rural in Deschutes County. So there's that, trying to embrace that gray area.
Right. And I know that we do want to push, I mean, if we talk honestly about access, pushing services out to the greatest degree possible to rural communities is obviously going to be really helpful. And what's really almost the only way to accomplish that true goal of access. I'm just, maybe the wording needs to be clarified so that people that are from Bend get the impression that I shouldn't apply. Large or small organizations.
Michaela, I know you're aware of the time, but what else did we need to accomplish, and do we need to ask those who are still here for a little bit more time, or?
So just a couple of minutes, I want to go over the needs-based funding distribution. And then I think we may need, I mean, we'll follow up next month, but we may need to send some questions or surveys out between now and then to get more feedback. So for the small group wanted to do a needs-based distribution, and originally we based it on Health County rankings. Let me try to get that slide up.
Michaela, can you tell us a little bit about what you mean by needs, just giving this as a concept and the rationale behind that? Can you refresh us on that?
Yeah, I'm trying to get us to that next slide, and I have a pencil as a cursor. Hold on. Gwen, pop in there.
Yeah, let me get in there.
So it goes back to, you know, where are the health disparities within our region, and, you know, conversations, you know, Linda, you maybe remember that conversation when we had the board meeting in Jefferson County, and, you know, we we want to provide services to folks, but there are no services in these smaller rural communities. And how could we, and the thinking for this group is how could we equitably distribute those funds based on the need? Gwen, do you have the link?
Oh, let me get that. Okay, so here's Sharon. Let me get the link too. Hold on, 2 things at once.
All right, there you go. I have my cursor back. Okay. So when we were talking with the small group, we talked about needs-based and we based it on those Health County rankings, but we received feedback that it needs to be based more on data, something more solid. And so an idea would be to base it on the poverty rates within each county. And so basing on the poverty rates, that distribution would look like this.
The only comment I have in this, I had this in our last meeting too, but I don't think I voiced it, is Klamath, because Northern Klamath is so, those communities are so small and the population is so small. That's the only one that I would question here. I guess it seems like it's too much, given like population needs to be a factor as well, I think, when it comes to that specific example.
Yeah. Coming up with a needs-based distribution or equitable distribution was, it's a little bit challenging because you need to base it on something, right? And when we start looking at population, Deschutes County is leaps and bounds above all the other communities as far as population.
Yeah, my first thought is like a redistribution of, I'm open to, I'd love to hear other comments too, but redistribution of some portion of that Northern Klamath to Crook and Jefferson.
Is there per capita measure we could use? Or some way to combine or have 2 points, one, so that, yeah, I agree, poverty rates would be, automatically, let's go to this. But then you look at the portion of funding that will go to a county that is not a part, it's a part of our service area, but it's not a part of the 3 county representation that's required by statute. And it is a small piece of the population. So I agree with Brad, that number feels too big. So if we were to do what Brad suggests with population and poverty rates and find some way to integrate those, that seems to me to be a finer twist on it.
Real quick, what percentage of Klamath County is within Northern Klamath?
I'm not sure as far as in percentage, you mean geographically, number wise?
Yeah, geographically, just for giggles.
Yeah, we could look at that.
And then maybe take that, let's say that it's 35% of Klamath is Northern Klamath. I'm just throwing a number out there. We take that 35% against the poverty rate. That might help, like, kind of feel a little bit more equitable. I don't know, just.
I think at this point, with us being over time, Gwen and I can do some more finagling with these and come up with some options to bring back to everyone.
That'd be great. Thank you.
Okay, and then just real quickly, timeline, June, we need to have this released, or an RFP released by the end of June. We're planning on hosting a webinar for applicants, information about the grant, how to access it, all of that. We'll release it for 60 days. September, you'll start to review the applications. And then October, we can make those funding decisions. All right, it sounds like we'll continue this next month.
And just for my clarity, who makes the final decision on these?
On the process,
The criteria that we're going to be printing up into the proposals that goes out? Who's the final decider on those? CAC is the final decider.
Mhm.
Okay, thank you.
yeah, within the
All right, well, thanks, everybody. Feel free to send any additional input to Michaela on this, on the community health projects. And to Miguel on the community engagement plan conversation. And thanks for hanging out an extra 8 minutes. I think it was good, lots of good input. And yeah, we're making a lot of changes to the community health projects.
And I want to thank
it's not been
everybody for their
easy.
hard work. It's a lot, it's complicated. People have done a lot of work to get it to this point. And I just want to acknowledge that. It's not easy.
That's not. Thanks, Linda. All right, everybody, enjoy the rest of your day.
Take care, everyone.
Adios.